back to another edition of E-ARTS Cambodia. The World Health Organization has called for more action to combat the spread of tobacco use in Cambodia in order to protect the next generations. May 31 has been declared World Not Tobacco Day, and smoking has been linked to an increase in disease severity and deaths among hospitalized COVID-19 patients. The WHO says that the use of tobacco causes deaths, economic losses, and contributes to environmental degradation, all of which pose a serious threat to sustainable development. According to the report, approximately 2.4 million Cambodians use some form of tobacco and are at a substantially increased risk of disease and early death. In fact, each year tobacco causes 15,000 deaths, and a third of which are among the poorest people in Cambodia. The suggestion is to scale up tobacco taxes to at least 75% of the retail price, with periodic increases to outpace inflation and income growth. Allocate part of the tobacco tax revenues to tobacco control and poverty relief measures, such as universal health coverage and supporting tobacco farmers and workers to switch to alternative livelihoods and other social protection schemes, the report says. The WHO has also called on stakeholders to raise awareness among the public and the policymakers about the true cost of tobacco and the dangers it poses, especially among low-income populations. Ministry of Economy and Finance spokesman Mia Sok-san says the decision to raise tariffs on tobacco products would depend on the results of a more detailed study which the government has already done in the past. He notes that the Finance Ministry has paid close attention to the control of tobacco products in the country, as stakeholders have made these issues priority for discussion. We have met many times to do a comprehensive assessment because devising and implementing tax policy is not easy, and raising taxes has its pros and cons, Sok-san said.